we'll discuss about the pancreas. The meaning of pancreas is all flesh because this particular organ is completely looks like a fleshy mass. There is no any color difference or anything throughout its particular structure. It's a soft, lobulated, elongated gland with both exocrine and endocrine functions. Pancreas is such a organ which is having both exocrine and endocrine hormones here, or secretions we can say. The exocrine is mainly concerned with the pancreatic juice, okay, which is helping in the digestion, and the endocrine is mainly concerned with insulin. Of course, there are some other hormones also. Insulin is considered main here because the islets of Langerhans is mainly concerned with the insulin, secreting the insulin, which is responsible for the metabolism of glucose in our body. Coming to the anatomical location of the pancreas, it is located in the epigastric as well as in the left hypochondriac region. You should note here, this is the epigastric region just above the umbilical region, and the left hypochondriac region above the left lumbar region. Both are above the transpyloric plane. It is lying behind the stomach as well as in the lesser sac. It is positioned transversely across the posterior abdominal wall at the level of second and third lumbar vertebra. You should note here one thing: the pancreas is a organ which is considered as retroperitoneal. It is present behind the peritoneal cavity, and it is resting on the posterior abdominal wall. Coming to the size and shape of the pancreas, in some books you will find it as J-shaped. In some books you will find it as retort shaped. I'll show you what is retort shape. I'll explain. And the length is around 15 to 20 centimeters. The thickness is around 1.2 to 1.8 centimeters, and the breadth is around 2.5 to 3.8 centimeters, and the weight is around 90 grams. So this is a retort. It's a particular pot which is being used for distillation process in olden days. So this kind of shape is known as retort shape. Coming to the parts of the pancreas. As you can see here, the pancreas is divided into 4 parts: the head, neck, body, and tail. This is the head portion, the beginning one, and the narrow neck, and the elongated body, and a small last part, that is the tail part. Of course, in some books you will find only head, body, and tail. Neck will not be considered. But in one more division is, they separate the uncinate process from the head and they consider this as a separate part. But here we are considering it as the part of the head itself. The uncinate process is considered as part of the head itself. So now we'll see each and every part of the pancreas and their relations. First one is the head. Head is enlarged part and is C-shaped, lying within the cavity of the duodenum. So you can see here, this part is the head here along with the uncinate process. Okay, it is occupying the curvature of the duodenum. Okay, so that is why it is said as C-shaped, and it consists of 3 borders and 2 surfaces and 1 process, that is the uncinate process. The 3 borders are superior border, inferior border, and the right lateral border. So this is the superior border here, like this. Okay, let me draw and show you. Okay, this is the superior border, and this is the right lateral border, and this one is the inferior border. And what you see here is the anterior surface, and the opposite one is the posterior surface. Coming to the relations of borders now, the superior border is related to the first part of the duodenum. As you can see here, this is the first part of the duodenum, and the superior pancreaticoduodenal artery, which is a branch of the hepatic artery. Second, the inferior border is related to the third part of the duodenum. Here you can see this is the horizontal part or the third part of the duodenum. Inferior border is related to the third part of the duodenum, and the inferior pancreaticoduodenal artery, which is a branch of the superior mesenteric artery. Coming to the right lateral border, it is related directly with the second part of the duodenum. You can see here, this is second part of the duodenum or the descending part of the duodenum, and also with the terminal part of the bile duct, and the anastomosis between the superior and inferior pancreaticoduodenal arteries. So in this picture you can see here, this is the superior pancreaticoduodenal artery and this one is the inferior pancreaticoduodenal artery. So inferior pancreaticoduodenal artery is along the inferior border, superior along the superior border, and the anastomosis around the right lateral border of the head of the pancreas. Coming to the relations of the surfaces here, first the anterior surface of the head is related to the first part of the duodenum. You can see in this picture here, okay, this is the first part of the duodenum, is partially covering the anterior surface of the head of the pancreas, and the transverse colon, of course it is not seen in this picture, but we can understand that the transverse mesocolon lies along this line, this plane, so the head anterior surface is also related to the transverse colon, and the jejunum, which is separated by the peritoneum here, because jejunum is an intraperitoneal organ. And of course the stomach, you can see here, the stomach is lying in front of the pancreas here. If you remember the stomach bed, the structures in the stomach bed, the pancreas is one among the structures of the stomach bed. So which means that the stomach bed are the structures which are related with the posterior surface of the stomach. So obviously the stomach becomes the relation of the anterior surface of the head of the pancreas. So when we say lesser sac, of course it includes the lesser omentum also, because the whatever the space which is behind the stomach and lesser sac, we call it as lesser omentum, we call it as lesser sac. The space behind the stomach and the lesser omentum is the lesser sac. Okay, in this picture we can see the transverse colon being in relation with the head of the pancreas. This is the pancreas here, okay. And of course the stomach also, you can, the outline of the stomach you can see here, okay, it is completely related to the anterior surface of the pancreas here. Coming to the posterior surface relations of the head, mainly here you need to remember the inferior vena cava and the bile duct. In this picture you can see the inferior vena cava being passing behind the head of the pancreas, you can see here. And if you remember the chapter of duodenum, there also we had seen that the posterior relations of the each part of the duodenum, there is inferior vena cava, and also in the chapter of portal vein we had seen that in all the three parts of the portal vein there is inferior vena cava being related posteriorly. And second important relation here is the bile duct. In this picture we can see the inferior vena cava. This is a posterior view of the head of the pancreas here, okay. That's why the duodenum is in the opposite direction here. So you can see the portal vein here and the bile duct, of course, okay, the bile duct, and of course the inferior vena cava. The portal vein is actually related to the neck part of the pancreas. And the remaining structures here which are related posteriorly are right renal veins and the right crus of diaphragm. So you can see the right renal veins here, the right renal vein is here, which is drained to the inferior vena cava, okay. And of course the right renal artery also can be considered here, and which just behind this particular inferior vena cava, you have the right crus of the diaphragm. Uncinate process is is a triangular projection which arises from lower and left part of the head, and it has got anterior and posterior as well as the superior relations. The anterior relations are superior mesenteric vessels. When we say superior mesenteric vessels, it includes both the superior mesenteric artery as well as the vein. You can see the blue color one here is the superior mesenteric vein, and the red one is the superior mesenteric artery. They travel for a certain distance together. The posterior relations are aorta, and the superior relation or the above, it has the left renal vein. Coming to the neck part of the uh, pancreas, it has got anterior surface and a posterior surface. In the anterior surface, there will be peritoneum covering lesser sac. You can see here, this is the neck part, and the peritoneum which is covering the lesser sac is seen here as a relation. And of course, the pylorus of the stomach will be related here. The pylorus of the stomach. To the posterior surface, there will be formation of portal vein along with the superior mesenteric vein. You can see superior mesenteric vein. The splenic vein is not considered here. Only the formation of portal vein as well as the superior mesenteric vein are related to the neck part of the pancreas posteriorly. And the neck has an upper border and a lower border. The upper border is once again related with the first part of the duodenum, and the lower border is related to the root of the transverse mesocolon. So this particular line corresponds to the root of the transverse mesocolon. So it is related with the root of the transverse mesocolon anteriorly or near the lower border. Okay, near the lower border. Coming to the body part of the pancreas, body is the elongated part, extends from the neck to the tail. It passes towards the left with slight upward and backward inclination. The body is a triangular structure in cross section. You can see here. This is a cross section of the body. Okay, it looks triangular. Okay, so there are three borders. So you can see anterior border, superior border, and inferior border. And there are three surfaces. Anterior surface, this is the anterior surface, this is the posterior surface, and an inferior surface. Borders are anterior border is here, superior border is here, and inferior border is here. Surfaces are anterior surface, inferior surface, and posterior surface. There is a small projection on the superior border just left of the neck part of the pancreas, and it is called as tuber omentale. It is called as tuber omentale. So here you can see this is the anterior surface which looks like this, anterior surface of the pancreas, and the here you can see this is the anterior margin of the pancreas. This line corresponds to the anterior margin, and alphabet E represents the inferior surface of the pancreas, and B represents the inferior border of the pancreas, and the C represents the superior border of the pancreas. So in between the superior border and the inferior border, behind we have the posterior surface. Coming to the relations of the body here. So first relation to the borders, the anterior border is attached to the root of the transverse mesocolon. Superior border is related to the celiac trunk, hepatic artery, and splenic artery. You can see in this picture here, this is the superior border here, and it is related to the celiac trunk here, and its branches, mainly the splenic artery and the hepatic artery, are here. Okay. The splenic artery runs throughout the body and the tail near its superior border, and the inferior border is related to the superior mesenteric artery. You can see here, this is the superior mesenteric artery here, and here is the inferior border. Inferior border is related with the superior mesenteric artery. Coming to the relations of the body in its surfaces. The anterior surface is convex and covered by the peritoneum related to the lesser sac and the stomach. As anterior surface is facing slightly upwards, so we can understand here that it is related to the stomach as well as the lesser sac. The inferior surface is covered by the peritoneum related to the duodenojejunal flexure, coils of the jejunum, and left colic flexure. So in this picture we can see this is the anterior surface and this is the inferior surface. The inferior surface you can see here, it is related with the duodenojejunal flexure as well as the coils of the jejunum and the left colic flexure. And the here you can see the root of the transverse mesocolon related to the anterior border of the pancreas. These two lines corresponds to the root of the transverse mesocolon. So this is a cross-section picture we can see here. Here is a pancreas. It is resting on the posterior abdominal wall. You can see these are the lumbar vertebrae. Okay, and you can see here it is covered with the peritoneum on its anterior surface here like this, and this ultimately forming the root of the transverse mesocolon. This is the transverse mesocolon, and here is the transverse colon, and this one is the stomach. So gap between the stomach and this particular layer of the peritoneum is called as the lesser sac here. This gap is the lesser sac. Coming to the posterior relations of the body of the pancreas. So posteriorly there is aorta, and abdominal aorta is related to the posterior aspect of the pancreas, and the left crus of the diaphragm, left kidney we can see here, this is the left kidney, and left suprarenal gland. Part of the left suprarenal gland is related posteriorly to the body of the pancreas, and the left renal vessels. Of course, from aorta there is left renal artery, and to the inferior vena cava which is present here, there will be left renal vein draining, and the splenic vein. Splenic vein is traveling exactly behind the substance of the body of the pancreas. You can see here, this is the splenic vein, which is joining with the superior mesenteric vein to form the portal vein. In this picture we can see the renal vessels. Okay, along the outline of pancreas is being marked here. Okay, so you can see the left renal vein is here, and left renal artery is behind, and the left kidney is here, as well as the left suprarenal gland is here. Coming to the tail of the pancreas, it is the left end of the pancreas. It lies in the lienorenal ligament. Lienorenal ligament is a peritoneal fold which is connecting the spleen as well as the kidneys together with the splenic vessels, related to the lower part of the spleen towards its gastric surface. Coming to the duct system, as pancreas is a exocrine gland, it's also a exocrine gland. Uh, it has got ducts, its own ducts, which is through which it is dumping the or it is transporting its secretions. Of course, the endocrine part is directly transporting the secretions through the blood streams, but here the exocrine needs to have its own ducts to transport the secretions. So mainly the pancreas has got two ducts here. The one which is larger one, larger is known as the main pancreatic duct, and the other ones, the smaller one, is known as accessory pancreatic duct. In this picture we can see here, this is the main pancreatic duct here, which opens into the major duodenal papilla along with the bile duct, and just above we have the accessory pancreatic duct, which is opens into the minor duodenal papilla in the second part of the duodenum. The main pancreatic duct is also known as the pancreatic duct of Wirsung. Lies near posterior surface, 3 mm in diameter. It looks white in color. Begins at the tail and runs throughout the body, bends at the neck to run downwards, backwards in the head, and it has got a particular pattern called as herringbone pattern, which looks like this, meaning it is collecting the small ducts from the different parts of the pancreas in this particular pattern, and the central duct is running throughout the pancreas. So this particular model is available in our library, in our museum. You can see the herringbone pattern. The same information once again. So in the head of the pancreas, it is related to the bile duct on the right side. The two ducts open in the wall of the second part of the duodenum and join to form hepatopancreatic ampulla of Vater, which opens as major duodenal papilla 8 to 10 centimeters distal to pylorus. This information we have already discussed in the chapter of bile duct as well as in the chapter of duodenum. Accessory duct of Santorini begins in the lower part of the head, crosses the main duct with which it communicates, opens as minor duodenal papilla in the second part of the duodenum 6 to 8 centimeters distal to the pylorus. Coming to the arterial supply of the pancreas, the pancreas is receiving its blood supply from the splenic artery, which is a branch of the celiac trunk, and the superior pancreaticoduodenal artery, which is a branch of the hepatic artery, and inferior pancreatic duodenal artery, which is a branch of the superior mesenteric artery. The venous drainage is to the corresponding veins, that is the splenic vein, the superior mesenteric vein, and ultimately both will drain to the portal vein. Coming to the nerve supply, the parasympathetic is by the vagus nerve, which is controlling the secretion. Sympathetic is from the celiac and the superior mesenteric plexus. Lymphatic drainage, the head and neck will drain to the ventral and dorsal pancreaticoduodenal group of lymph nodes. The body and tail will drain by the pancreaticosplenic group of lymph nodes, and both these group of lymph nodes will dump the lymph to the celiac as well as superior mesenteric group of lymph nodes. Coming to the applied anatomy, there are congenital anomalies involved with the pancreas, trauma, and the inflammation or the infections related to the pancreas is known as pancreatitis, and the tumors related to the pancreas. This is a congenital anomaly, annular pancreas, where the pancreas is encircling the part of the duodenum or sometimes the pylorus of the stomach, and with which it's obstructing the passage of the duodenum. Trauma, in many sudden forceful compressions of abdomen such as steering wheel in road traffic accidents is going to injure the pancreas. So pancreatitis may be primary or secondary due to the gallstones or any other conditions, and it results in the collection of fluid in the lesser sac, and the pain is poorly localized. Refer to the epigastrium. Acute pancreatitis is serious clinical condition, may be due to the mumps sometimes. So it's one of the important complication of the mumps. Carcinoma of the stomach, it is common in the head, and it causes obstructive jaundice due to bile duct compression, and it causes ascites due to portal vein compression, and it causes pyloric obstruction also. So these are some of the applied anatomy related with the pancreas.